We are all in this together, held in the grips of a virus that can be deadly and so far cannot be stopped. Good evening, everyone, and we thank you for joining us tonight. I'm Colleen Marshall. From the War Room at the Ohio State House, Governor Mike DeWine and the Ohio Health Department Director, Dr. Amy Acton, have been pushing out information on the coronavirus, telling us about the importance of social distancing and, one by one, restricting the things we can do, the places we can go. Sporting events, restaurants, bars, businesses, all closed because of this global pandemic. Tonight, we're going to be joined by the governor, Mike DeWine, Dr. Acton, experts, and importantly by you, viewers from all over the state and from parts of West Virginia, joining us from our sister Nexstar stations, not to just take in the latest numbers, but to get answers to your questions. We are social distancing with our experts tonight, grateful they can spend the next hour with us, helping you understand this health crisis. Governor Mike DeWine and Dr. Amy Acton, the Ohio Health Director, Matt Habash, who heads the Mid-Ohio Food Bank, and Dr. Ian Gonsenhauser. He's the Chief Quality and Patient Safety Officer at the OSU Wexner Medical Center. We're going to thank all of them for being with us, but we're going to begin right now with Matt Habash, because we've been talking all week about how children who rely on schools for their breakfast and their lunch are being helped with the closure of bars and restaurants, retailers, and as of today, hair salons, spas, and estheticians. More and more hourly employees are now going to be missing paychecks. So, Matt, we're going to ask you, are you anticipating more of our neighbors needing food assistance, and what are you doing to try to help them?
Yes, we definitely anticipated. Ever since Dr. Acton and the governor began to put out the idea of social distancing and the ramifications of what was going to happen, we went into a totally different mode. You got to remember, we've been doing a choice pantry, shopping pantry model for a long time, encouraging people to pick their own food. A lot of people in a gathering space, and we're like, well, this isn't going to work. So we immediately changed our process and to recognize first that we needed to practice social distancing, and we've been doing that very well. If you come to the food bank tonight, there's 60 cars outside instead of a group of people standing in a line, and we're serving them that way. We also recognize that we're already up about 20% in the amount of food that we're distributing, and our pantry here at the Mid-Ohio Food Bank is already up 52% from the same week a year ago.
A lot of people want to know, how can I help? Some of us are still working, but they're afraid, can we go and give provisions to you? Is it safe to hand them out, or are there going to be long lines there? What should we do if we want to help out?
Well, a couple of things I'm going to suggest. One is I'm taken very seriously. One of the things people always want to do, I call this managing America's generosity. People want to help. But what I don't want people doing is going out and starting food drives and collecting food. That will simply just drain the grocery stores faster, make it harder for people to get food. So we've set up a fund here. There are a number of other funds. We immediately, when the governor began this process, and I really thank him for being so proactive, we started calling to order food even before we had the money, anticipating, in addition to 500,000 people we touch a year, we're going to be serving a lot more people, and this may go on for a very long time. Volunteering is okay right now. We are practicing social distancing. We clean this building every day. We're going to do mass cleanings on weekends.
Good to know.
So we are making sure that this space is clean. We've gone to, yep. So as far as we're concerned, we're taking this very seriously, and the practices we're doing here, we're sharing with all of our 600 partners across the 20 counties.
Matt, we'll be checking back in with you later. Thank you so much. We're going to go now, though, to Governor Mike DeWine and the Health Director, Dr. Amy Acton. And we thank both of you for being with us. We know this has been a grueling few weeks for you. Governor, first up, several people wanted to know from Dayton, Columbus, and Youngstown, is Ohio going to go into a full lockdown like we are seeing in other parts of the country, where everyone is told to simply shelter in place?
I don't think we know that yet. What we're trying to do is, you can't really get ahead of this. But we know that taking action earlier is better than later. I've used the illustration from 102 years ago of St. Louis and Philadelphia. St. Louis got it right. Philadelphia did not, but they were only about 2 weeks separate in what they did. So in other words, St. Louis got it, but 2 weeks later, Philadelphia was doing it, and it made all the difference in the world. Philadelphia lost so many, many more people. So what we've been trying to do is focus on this social distancing. It's a term that I'm not sure I ever heard of before, but it's a term I'm using every day. But it really, Colleen, it really describes what we have to do, because people many times will say, you know, what order are you going to issue next? What are you going to do next? And what I've been saying is, government can do certain things, but really the people who are watching this, Ohio citizens, can do so much more. They can make decisions in their own life. They can be very, very careful. They can not go where there are crowds. You know, if you're elderly, stay in your house if you can. Try to get someone else to, you know, maybe bring the food to you and help you, because we know people 70, 80 years old, you know, they get more, it gets much more lethal for them. So it's what we can do ourselves, and that's really what our theme has been. Just be very, very careful. You know, don't go out unless you have to go out, and that's really true for everyone. So whether we get to the point where we're totally locked down, so to speak, I don't know that yet. But you know, Dr. Acton may have an opinion about that.
You know, Dr. Acton, we also have a question for you from Peggy in Cleveland, and she says, I live in Northeast Ohio. It seems to be the epicenter of this crisis in the state of Ohio, and she wants to know if it's because there's more testing being done there, or if they really have more cases in the northeastern part of the state.
Well, thank you so much, Peggy. I asked myself that very same question, and you know, right now, because of the lack of testing we had all along, we saw that the Cleveland Clinic and some of the areas got up more quickly. So I do think some of what we're seeing, even though we know we have a number of counties and areas of spread across the entire state of Ohio, we are seeing more activity in the Northeast Ohio region where I'm from, and we definitely have more testing in that area. So I'm thinking those two are probably related, but I think at this point it's safe to assume that we pretty much have spread throughout Ohio.
You know, Dr. Acton, we also are hearing here at our station and sister stations around Ohio are getting a question about diagnosis. So a viewer from Mahoning County put it this way: if you are diagnosed with COVID-19, how soon can you return to work? And does that mean you then have immunity?
Well, that's a great question as well. And so most of us will go through this illness and be able to stay at home. In fact, studies so far show that about 80% of us, we might have a very bad flu. In fact, one that might feel a little bit more severe than one we've had before. But in guidance with our doctor, we'll stay at home. And most of us won't get tested. Even myself, you know, I might not need tested. If I have the symptoms and I talk to my primary care provider, they might just say, you know, stay at home. So what we're looking for as clinicians is that you go 72 hours without a fever, without any aspirin or Advil or anything that's artificially lowering your fever. And then we'll also make sure that you're at least 7 days post when you first showed signs of the illness. And that's the latest CDC guidance, and that's what our docs will be following.
We also got a question, Doctor, if I can ask you this, but from an employer. Your recommendation now is that employers start taking the temperature of their employees from one of those distance forehead kind of temperature takers as they come into the building. So let's say the person tests at 98.9 or at 99. At what point does the employer have the responsibility to say to the employee, you need to go home now?
These are great questions. I would say temperature is a tricky thing. We all run a little bit differently. We all hear 98.6, but some of us run a little cooler, some of us a little warmer. And that really is, typically the temperature we are looking for is in that 100, 100.5 range that we would actually call a fever. But the thing is, as an employer, I would be asking that employee how they're feeling. And we're all going to be taking our temperature a lot, I think. It's not a perfect system. You know, some people might not show fever. We all know that you can be infectious when you're asymptomatic. But anyone who has feelings of being sick with anything that feels like the flu or a common cold, we all need to stay home the second we're not feeling well. So one thing we can all do is sort of check ourselves first thing when we get up in the morning.
All right, thank you. And Governor, earlier today, Mrs. DeWine, Fran had some great advice for things to do with your children when you're at home and you're trying to keep them occupied, because we're all going to be getting cabin fever. But we had a question from Pam in Grand Lake St. Mary's, who wanted to know, I'm a senior citizen. I've been told to stay away from my children, my grandchildren. So is it safe? And Governor, do you and your wife feel safe when you're spending time with your grandchildren?
Well, these are grandchildren that live very, very close to us. You know, they're in and out of the house all the time. The kids are no longer in school. You know, what Dr. Acton has told me, and she can tell all our viewers, but is, you know, you need to keep that number very, very small. And, you know, obviously you need to be very, very careful. These are grandchildren that live right down the road. They're in and out of our house, you know, all the time. But I give the same advice, be very, very careful. You know, they don't go over now, for example, to Fran's mother. Fran's mom is in her 90s. She loves to see them come over, but they no longer go over there.
All right, thank you so much, and stay with us. How do you properly quarantine yourself or a loved one? When we come back, Dr. Gonsenhauser is going to show us how to do that.